All right, so you've already heard what McKinsey is and what we use it for, but we also use it to classify our patients. So when somebody comes in, yeah, they may have back pain, but we need to classify truly what that back pain is. Is it a disc referring pain down the leg? Is it a joint just being stuck? Do we need to go in and adjust it or motion it a bunch? Or is it ligament? Is it tendinous? Or is it just positional or posture? So when a patient comes in, we do a case history, basically just figuring out how this started, what are some of the common ways that it gets worse, some common ways that it gets better, just how is that patient feeling. Then we do an assessment, and this is where we start to really classify. We'll do a bunch of tests and we'll do some repetitive motions, go back to those tests. That allows us to classify what this pain is. The most common thing that we see is it's what we call a derangement, but it's just a fancy name for if it's in the spine, it's a disc irritation or disc referral pattern that we can treat pretty quickly with some of these repetitive motions. So if you've been in our office, we do a bunch of these, we do a bunch of cobras, we make you do a motion multiple times. And the reason is we are trying to affect the pressure in the disc. So I'm gonna draw on the marker board. If you've been in our office, you understand my drawings. So we're just gonna show you how that goes. So the disc model, this is just the most common thing that we see in our office is low back pain. And so we're gonna draw this. So if you can see, this is a picture of your low back. This would be the front side of your back. This would be the back side. And this is like your sacrum or your tailbone. And these red things are the disc. It's no secret that when we work or we sit a lot more than we really should all day long. So we sit in postures where we're folded forward just a little bit. And what happens is we pinch the front side of those discs and we put pressure on them. And we do it on multiple layers. So often when somebody comes in with back pain, we can't really decipher if it's exactly one level, but it's probably more likely it's multiple levels. So we get pressure on the front part of those discs, they pinch down. This jelly that's in the middle of our disc starts to migrate backwards, and it gets pressure back to the back side of that disc. What that looks like, bird's eye view, is the jelly in the middle. We have a bunch of rings of tissue that try to hold that jelly in middle, and these rings are they're cartilage, and they bend and allow us to be able to move and absorb forces and things like that. But if we're sitting for long periods of time, we get pressure on the front side of that disc, and jelly gets pushed back here. And now, if we are pushing that jelly or we have so much pressure on the front for long periods of time, these rings can even break down and we can go to different levels. Now, I like to think of those rings as just different levels of pain. So if somebody has pain that goes down their leg, maybe that's an extra level of those rings being pushed on or pressure. So when we have somebody do a repetitive movement, what we're doing is having pressure basically on the opposite side, getting jelly to go back to where it originated from or get back to the center so that there's not as much pressure on those rings. It seems like rocket science, right? But what we have to do, or what we make sure we do, is that we reload this multiple times throughout a day to counteract how much we bend forward or counteract the movement that is causing some of that pain. So this is what we call the disc model.